Assalamu alaikum and welcome to my channel. We educators. Today I'm going to tell you about very interesting topic, malaria, causes, symptoms and treatment. So what is malaria? Symptoms of malaria include fever and flu-like illness, including shaking, chills, headache, muscle aches, and tiredness. Nausea, vomiting, and diarrhea may also occur. Malaria may cause anemia and jaundice, yellow coloring of the skin and eyes because of loss of red blood cells. So what is malaria? Malaria is disease caused by a parasite. Parasite is spread to human through bites of infected mosquito. People who have malaria usually feel very sick with a high fever and shaking chills. While the disease is uncommon in temperate climate, malaria is still common in tropical and subtropical countries. So malaria causes fever, illness, and sickness, and shaking chills, high fever. So malaria is the disease which causes human illness. What are the symptoms of malaria? In malaria, the sign and symptoms are fever, chills, general feeling of discomfort, headache, nausea or vomiting, diarrhea, abdominal pain, muscle or joint pain, fatigue, rapid breathing, rapid heart rate, cough. So these are the symptoms for malaria. Some people who have malaria experience cycle of malaria attacks, and attack usually start with shivering and chills followed by high fever followed by sweating or return to normal temperature. Malaria signs and symptoms typically begin within a few weeks after being bitten by an infected mosquito. However, some types of malaria parasites can lay down dormant in your body for up to the year. Mosquito transmission cycle. Uninfected mosquito. A mosquito becomes infected by feeding on a person who has malaria. If any person who is infected with malaria, and the other person can get malaria also if the food or if the feeding of that infected person can eat the other person. So you have to be careful. Transmission of parasite. If the mosquito bites you in the future, it can transmit malaria parasite to you. It is like if a mosquito is biting you in future, so it can transmit malaria parasite into you. In the liver, once the parasite enter your body, they travel to your liver, where some types can lay dormant for as long as a year. If parasite is entering in your body and they travel or they goes into the liver, and you don't take treatment, if you haven't take treatment within few days, so your body will get damaged from, or you will get a year the malaria, your parasite will live in your body or in your liver into the bloodstream. When the parasite matures, they leave the liver and infect your red blood cells. This is when people typically develop malaria symptom. If malaria parasite is mature and it live in the liver and infect your red blood cells, if it is living in your liver, they, as it's normal, they will uh, affect your red blood cells, and this is when people developing malaria symptom. When your symptom of malaria, you are thinking that yeah, it is malaria, then the parasite will get mature and it will go into the liver. On to the next person. If an uninfected mosquito bites you at this point in the cycle, it will become infected with your malaria parasite and can spread them to the other people bite. So it can transmit it into other people also. Malaria is infected by one person, it will go to another person also. So prevention, how we can get prevent from malaria. If you live in or are traveling in an area where malaria is common, take a step to avoid mosquito bite. Mosquito are most active between dusk and dawn. To protect yourself from mosquito bites, you should cover your skin, wear pants or long sleeve shirts, tuck in your skin shirt and tuck pant leg into sock. Apply insect repellent to skin. It's also good for your prevention, apply repellent to clothing, sprays containing permethrin are safe to apply to clothing, sleep under a net. So it's good to sleep under a net. If you are sleeping on bed or anywhere, you have to take a net and sleep under that net. That will protect you from the mosquitoes. For treatment, there's vaccine. The World Health Organization has recommended a malaria vaccine for use in children who live in countries with high numbers of malaria cases, so they can take that vaccination. Uh, so the malaria vaccinated to prevent infections. But if you want to get treatment at your home, so these are very normal. What are the home remedies for malaria? I am going to tell you. There are some common herbs that you can use at home to help you with symptoms of malaria and its recovery. Herbs like tulsi, neem, ginger, cinnamon, turmeric, guduchi, and krishna musali may be used to relieve malaria symptoms. So these are the uh, herbs which can help you to from get rid from malaria or recovery from malaria. That accepted many other doctors or other doctor have recommended some home remedies, so you can take those home remedies. Or if you want that, I will share with you the home remedies for malaria. So I will share you. You have to just comment in the comment section, then I will share some home remedies. So in today's video, I just explain you about malaria. What is malaria? It is serious common infection spread through the mosquito parasite, and which goes into the human body, and it goes into the liver of the human and cause the infection in human body. And what are the symptoms of malaria? Fever and chill, sweating, shivering, nausea, shivering, diarrhea, headache, muscle fatigue, chest pain. These are the common symptoms for malaria. If anyone is getting these types of symptoms, then he should or she should have the malaria. So how can you do malaria recover? How can you get recover, or what are the home remedies? Ginger, turmeric, cinnamon, tulsi, neem, guduchi, coconut water, krishna musali. These are the home remedies for malaria. Malaria treatment is normally by the vaccination. If you want vaccination, you can go to the doctor and get the vaccination, and your treatment will be good, and you will get rid from the malaria. But if you want home remedies, so you can get home remedies, and then you will get rid from the malaria, as it is very common disease, and a child and adult get from malaria. uh, Today's topic was very interesting. If you like my video, you must subscribe my channel and give it a thumbs up. Allah Hafiz, bye bye.